Hi, it's still Saturday, August 24th, 2019, and welcome to my PCD Life. So this is my second video. This is my interview from the PCD conference with Michele Manion. And, you know, she's just so busy. That woman is just incredible to me, her wealth of knowledge and everything she's done for us PCD patients. And you know, just the treatments, the diagnosis. I mean, the research. Yeah, you know, there are people doing the research, but you know, without she is such an important cog in that system, and you know, for us patients, you know, we wouldn't be looking at. You know, I don't think we'd have half as much knowledge as we do about PCD if Michele hadn't started the PCD Foundation and start pulling people together and having people take this disease seriously. And that's still an uphill battle. You know, the FDA is still saying PCD isn't a serious disease. So anyway, here's a little bit of here's my interview with Michele, but you know, just a little bit of her knowledge, and I really appreciate her taking the time to speak with me. All right, so this is Michele Manion, for those of you who don't recognize her face. It's surprising that her eyes are open. It's the last day of the conference, and Michele has been gracious enough to hop out of a meeting to do this video. So Michele, you know, great meeting. Very informative, you know, a lot of hope for what's coming up on the horizon.
Yeah, it was a great meeting. And Mary, your support in coming to these things is fantastic too. We really appreciate it.
Thank you.
But we've been, 2.5 days talking PCD all the time. We started with basic science session, then we moved Thursday into clinical science and talked about some trials that are done and trials that are coming up. And this morning we talked about the future of research and where we're going. Unbelievable amount of stuff going on, and it's gonna take a village. We're gonna all have to get involved here to make these things happen. But we had researchers here from Denmark and from Germany, from Scotland and from Japan, and everybody is coordinated and clear in their unity on wanting to get some stuff done in PCD. So the expressed goal is 95% of all genes being detected within the next decade, so that genetic testing will be available, genetic cures will be, or treatments will be possible for PCD.
All right, and there's 43 confirmed genes now?
43 confirmed and multiple still in process of being published.
Yeah. So we had opened up, or I had posted on Facebook asking the patient group if there were any questions, and one of them you know, acknowledged that there's such a variety, and they talked about that in the conference, of you know, how PCD presents, but it was asking about life expectancy. So if you could talk a little bit about that, that'd be great.
So that's a natural question that patients want to have answered, and sadly we don't have life expectancy data. We will shortly. We just are launching a registry, patient registry this week. Well, it will start up in the next few months, but we announced it today, and that for that exact reason, to start getting this data. What we have been collecting as a foundation for about 12 years, maybe a little longer, is age at death. So when patients in the group will pass away, we've just kind of kept track of their gender, their age, if we knew the gene, and then the situs status. And that data is limited because it is just a small selected group. It's people that we know, so it's not looking at the entire population, and it should not be confused with life expectancy. It's not measuring the same thing. But what we've seen over the years is that there are patients with PCD who succumb to their disease in their 30s. There are some in their 40s, and some in 50s, some in 60s. But at the flip side of that, this is a disease with a huge spectrum of severity. We also have people not being diagnosed until they're 80. So there is a lot of individual reasons why people have better or worse health, and don't let the numbers scare you. It's not real clear yet, and it's a disease that's very, very diverse.
So one of the big things, you guys had a press release come out, as part of the conference, about the registry, PCD registry, and can you just kind of talk about the importance of that, how patients can be a part of it, where they need to go, and any other information you can share.
Okay. So I think it's good to start with what a registry is because the term is used differently. What we wanted to do was kind of recreate the success of the CF Foundation, who, when they started with their registry, which is a collection of very high quality, credible data, patients were living an average age of 12, and they are now living, and this is in the US, their average age is 47. And that's because the data in the registry drove pharma companies to look for therapeutic targets, which drove therapies that have been very effective. So we want to do the same thing. You want to hit a natural history of the disease so you can see what to expect, then you know if your drug is actually working and fixing things. But we also want to know as a patient group, what are our demographics? Where are the patients? How long are they living? How many have transplants? We cannot answer those questions right now. So part of this is to answer those questions. And to do it right is, first of all, very expensive, but it also needs to be done at centers, needs to be entered through a medical center. So the data will be entered through our PCD centers at least to start, and as the PCD network grows, then we're hoping that more and more people will be able to go to a center and be part of the registry. The platform that we chose has the advantage of also being able to add in additional projects. So we're hoping to also do a patient-reported version of this so that patients everywhere can participate in at least a piece of the registry. This won't be the clinical data. We still need you all in the clinical data piece too, but patients will be able to also share their life experiences. We want to have a much better picture of what it's like to be a patient with PCD every single day. So that's the goal of the registry.
I hope you found what Michele had to say informative, and tune in. There's going to be a little bit more. So I'm going to do a video just kind of sharing some of the information from the conference. There's not a lot that I can share detail-wise, but just a little bit, and a little bit more about how we patients and parents really need to be more involved. And I also got to try out one of the new airway clearance machines. It's called a Cough Assist. So I'm also going to be posting a video of my using that in the next day or two. So thank you for tuning in to this episode of My PCD Life.